There are two avenues to provide feedback to our network. Submitting a comment from the HSSN webpage. There is in our agenda a public comment item that's a standing item. Comments are limited to 2 comments per meeting at the designated time and each given 2 minutes. To request a meeting or a comment during this meeting, direct messages can be sent to Lindsay Dent by 8:45, including a quick topic description and the organization you represent. The first 2 requests received will be provided an opportunity to speak for 2 minutes, and additional comments can be submitted through an online public comment link. So again, those need to be by 8:45 to Lindsay Dent or by using the link provided. And at this time, we're going to pivot to a program update from Katie.
Adam. Hi all, Katie Gentry, I use she and her pronouns, and I'm with Washington County. I'm the homeless programs manager. Wanted to provide just a few updates of all things Washington County that is going on right now. First and foremost, we have a number of procurements that are underway. The first procurement is a procurement for our Cornell Road transitional housing that is focused on recovery that will open next late summer, early fall. That project has not yet been selected, but the procurement is closed for it, and we hope to make an announcement in the coming 2-ish weeks about an operator for that project to start planning in partnership with us and with all the work that is happening at the CAT in Hillsborough and Beaverton. The next procurement update that I have is for our permanent pod site. So we have been operating temporary pod sites for the last almost 4 years now. And we have committed to 2 years at each of those locations. And we are currently in the process of acquiring a permanent location. So we will be putting out an RFP probably early to mid next week to launch that procurement. It will be open about 5 weeks, seeking a permanent location or a permanent operator for our permanent pod location. How many times can I say that in different ways? And so that will be a 60 pods all in one location. We're combining our 2 separate pod sites into one location to hopefully open in the spring, depending on how site preparation goes for that new location. That site will be county owned, and then we're looking for an operator to run the shelter operations there. The last big update I have is we were going to RFP for a housing resolution fund operator, and we decided to take that in-house. So Washington County will be launching that program in January. So if you were previously looking for that procurement is no longer going to be procured, and Washington County will be doing that service. Some other updates to keep in mind: we are actively wrapping up our fiscal year for last year and looking at kind of just closing out the book. So as we go into kind of the rest of this fiscal year, really evaluating where do we have funding available and what does that look like. If you're interested in learning more about that, there was a great conversation at Solutions Council last 2 Thursdays ago, I'm losing track of time, about how we allocate any one-time funding that has not been expended. And the last big thing, the federal government shutdown is something that we are keeping an eye on. There is currently funding for all of our programs through mid-November. If shutdown were to go beyond that, we would be evaluating kind of the ongoing challenges with cash flow. But it is something that we are keeping a close eye on and being ready to be prepared and responsive to, because a lot of our department is funded with federal funding, both on our housing authority side and through our continuum of care funding. Those are all of my procurement and funder updates. The last programmatic update I have is today we are rolling out our rehousing policy. That is a policy that specifically looks at how folks are rehoused through funding provided by Washington County. So if you're a contracted partner with Washington County, look for an email from me later today. And then we have also rolled out some new guidance and helpful documentation in our Power DMS site related to utilities. So I think that is all from me, Adam, but happy to answer any questions that folks have.
Okay. Thanks, Katie. All right. I don't see any questions coming in at the moment. Okay. Well, we'll move forward to our speakers, our presentations today. First, we're going to be hearing from Alyssa with Health Share. Alyssa, are you all set to go?
Hi, good morning. I am. Let me get a slide deck presented here. Let's see. Sorry, I know everybody has their excuse. We are a Teams shop at HealthShare, so I am, let's get, give me 1 second, get my slideshow running. All right, are you all able to see that?
Not yet.
Okay, how about this? Still no?
There we go.
Okay. Well, good to see you all today. Hi, my name is Alyssa Craigie. I'm the Director of Health System Integration at HealthShare, and I'm here to give an update on the health-related social needs benefits. So just a little bit of background. So HealthShare is one of 2 coordinated care organizations in the Tri-County region. We partner with the state of Oregon to deliver the Oregon Health Plan benefit package to the members of our CCO, our coordinated care organization, who live in Multnomah, Clackamas, and Washington counties. And CCOs are really designed to bring together health plans, providers, community resources across our region in order to serve members of the community. HealthShare partners again with Trillium in this region. We have about 460,000 members who participate in the HealthShare Oregon Health Plan package. So talking today a little bit more about the HRSN or health-related social needs housing benefit. This is really made possible by what's called a Section 1115 demonstration waiver. And I use those words even though they're kind of wonky because they're out in community, and I know that many of you may have heard that term. So the demonstration waivers are they provide the opportunity for states through an agreement with the federal government to negotiate changes to the way that Medicaid is delivered. The Medicaid is the same thing as the Oregon Health Plan in the state of Oregon. So changes to the way that the OHP benefit package can be delivered. The goal of a waiver is to offer states the opportunity to test new approaches that will do 3 things. They'll improve care, they'll increase efficiency, and they'll reduce costs. Waivers are typically approved for 5 years. So HealthShare is in the middle, the state of Oregon is in the middle of our 5-year waiver period. And one of the exciting things that came about as part of our recent waiver is the opportunity to provide what are called health-related social needs benefits. And those in Oregon are 3. There are kind of 3-fold benefits. One is around climate, also recently rebranded Home Changes for Health. So that provides the opportunity for members who have qualifying life transitions and clinical conditions to receive climate devices such as air conditioners or heaters to support their overall health. Housing we'll talk more about, and then nutrition services are also part of the waiver that Oregon is operating under right now. Our waiver goes through the end of September of 2027, at which point we would have to either renew or have that extended. So the housing benefits are what I'm here to talk most about today, and what I assume most of you are at least moderately familiar with. So I'm going to provide a kind of I'm going to go a little bit deep into the weeds, and I'm happy to answer questions from the team as appropriate. But to talk a little bit about the housing benefits, they provide the opportunity for members of CCOs who meet those qualifying life transitions and are at risk of homelessness to receive support up to 6 months for rent assistance and arrears, for utility supports. And then those are kind of the two most common ones, as well as tenancy supporting services and home modifications in particular situations. So the two that most people are applying for and are most interested in are the rent and utility assistance, along with some of those wraparound tenancy services. So CCO started offering these benefits in the state of Oregon in November of last year, again, primarily to help with housing and utility costs. What we know is within HealthShare, at least around 2,500 members have received assistance through these benefits since last year. So I want to start with that really powerful success, knowing that this has not been the smoothest rollout, but really wanting to acknowledge that those are 2,500 members and their families whose lives have really been changed by access to these particular resources. At the same time, the HSSN housing benefits did launch, as you know, during a time of unprecedented community need, partly due to lingering effects from the pandemic, also rapidly rising housing costs, particularly in large urban areas. So those of us in the Tri-County region have really experienced the rollout of these benefits in a different way than other parts of the state. So we do know that the program has long wait times for both the housing and the utility assistance, which we are not thrilled about and have some active efforts underway to improve the access to these particular benefits. So we're engaging with the Oregon Health Authorities. This is a benefit that was designed by the Oregon Health Authority, and we operate the program, again, through the Oregon Health Plan, but under contract with the state of Oregon. So we're engaging with the team at OHA to improve the required processes. Implementing housing as a Medicaid benefit is a new and really incredibly innovative approach. It's also new and incredibly challenging, right? We're learning how to do this work across systems. And I know many of you on this call have had partnerships with healthcare entities, perhaps with HealthShare ourselves, and some of the partners that we work with in the Tri-County region. So engaging deeply, though, with the state to improve those required processes. And then we are in the process of dedicating additional funding and resources to increase our capacity to deliver these services. So just to spend a minute talking about the timelines for access to these rent and utility assistance benefits. The part of what has been challenging is the narrative that has emerged that these are services that are designed to respond to emergency needs, that are designed to prevent an eviction. The reality is that the timelines for accessing these services are longer than is likely reasonable for somebody who is in an eviction process. So the approval timeline might not meet the needs of members who have an urgent need. Again, we're actively working to improve that response time, but given where we're at today, it's been challenging to meet the needs of members whose experiences are quite urgent. Members are also receiving letters, so they get approval letters. That's part of being a Medicaid benefit, right? We're required through federal law and through our contract with the state of Oregon when a service is authorized, we have to send a letter to the member letting them know that that service has been authorized. Along with that comes particular rights to those benefits. And so we have updated those letters that we send to members to try to make it clear on what those timelines are. We partner closely with Care Oregon on the implementation of this benefit. They're one of the key partners in the HealthShare Collaborative. So those letters come co-branded from HealthShare and Care Oregon. Often there's a need for additional outreach to obtain more documentation. So again, implementing housing services, rental assistance as a Medicaid benefit means making sure that you have the ability to code the services to the appropriate timeline and that you can invoice for those and that you have documentation on exact costs. So again, lots of learnings, lots of opportunity in this work and potential to continue to improve our processes, but some challenges come when that additional outreach is needed for additional documentation, particularly for members who might not otherwise be engaged in services. So members have the ability to make requests on their own. They can also work with their healthcare providers or community partners to make those requests. And if they have questions about their status, they can always call the Oregon customer service team at that number there. I will say wait times are also a little bit longer than we would like. So continuing to work on improvements in that way. So to talk just a minute about the provider network. So we do have a network of housing providers. These are mostly community-based organizations who are able to support the delivery of these benefits. We have network engagements. We partner closely with those providers. I see some of you here on this call today to make sure that we have the right amount of technical support and training for providers. Again, doing this work in the context of a Medicaid contract is a little bit different than business as usual for most housing service providers. We do have additional network expansion efforts underway. They're ongoing, really focused on capacity and equity goals as well. So just a quick view then of our network of contracted HSSN service providers. This is in the housing space in particular. I'm not talking too much about the climate and nutrition benefits, although could answer questions there if that would be helpful. So the ones that are bolded are providers that are working in Washington County. So of the network of contracted providers, Bienestar, Centro Cultural, Community Action, Project Access Now, and United Way are all partnering currently under active contracts with HealthShare to deliver these benefits in Washington County. We've been working closely with your team at the county to help determine how you all fit into this work. And we've recently identified a role that we'll be continuing to pursue to support processing some of those incoming requests for folks who are residing in Washington County. So I know I only had about 10 minutes for this presentation this morning, so I wanted to give a pretty high overview, but I am happy to answer any questions if that would be helpful, or those of you who have been participating in this work, also happy to hear your perspective as we go forward.
We can take a moment for questions. We've got time. You could put questions in the chat or unmute and ask your question for Alyssa. Looks like there's a question here, Alyssa, if you're reading. Do you have recommendation for community members should reach out and get more information if they are unsure if they have OHP or primary care doctor?
Yeah. I'm sorry, I'm realizing at some point I turned my video off here and my screen's got all reoriented. So for members who don't know if they have OHP, they can always reach out to the HealthShare customer service line, and the team at HealthShare can help them determine if they have OHP. If they're assigned to a CCO, they will have been assigned to a primary care provider as well, who can help support getting them access to care.
Thank you. Okay, any other additional questions? Okay, well, we can move forward, and Alyssa, maybe just keep an eye on the chat if a question pops up related to your presentation. And we're going to move now to Justin from Metro. Justin, you should be all set. Take it away.
Awesome. Thank you, Adam. Hello, everyone. My name is Justin Barrio. I use he, him, his pronouns, and I'm the training program manager on Metro's regional capacity team. Before I pass it off to the rest of my team for introductions, however, just want to say thank you all for making time for us in this space again. The last time we came here was, I believe, November, and we've made some significant progress updates to our programming since then. And we are grateful for the opportunity to loop back and let you all know some progress updates. And so we'll be going through our progress updates on the PCC program we're creating, highlighting a few training resources that are available now or will be in the near future, and walk through some engagement opportunities that we have, which we will allow you all to participate in. And without further ado, I'll pass it over to my colleague Malia for introductions.
Thanks, Justin. My name is Malia, she, her pronouns, and I'm a program coordinator on this team, and it's good to see a lot of familiar names and faces. I'll pass it to Cole.
And good morning, everybody. Cole Merkel, he, him, his pronouns. I am the Regional Capacity Manager at Metro in the Housing Department. And I'm super excited to be here and to update you all on our training work with my amazing colleagues, Justin and Malia. As we dive into this, a couple of things that I really want to just emphasize. First and foremost, the work that we're doing to advance training is entirely in line with work that we're trying to do to regionalize while also recognizing the unique needs in each county. And we've been working really closely with our partners at Washington County to develop out the programming that we are about to share with you. Want to give a really big shout out to Lindsay, Carly, Chelsea, and so many other folks at Washington County. Nicole's been a huge supporter as well. And many of you who've also had one-on-one conversations with us to help us shape this work. So I think that's a really important caveat as we go in this. This isn't just Metro doing a thing on its own. This is Metro doing a thing very collaboratively with our 3 county partners. And again, I really especially want to thank Washington County for their amazing support on this. And with that, Justin, do you want me to just dive into the deck? Awesome. All right. Well, first and foremost, we're going to do a little bit of orientation because I know that y'all know what Metro is, what Metro does, but I think it's also important to just kind of remind folks like kind of what our role is, what the county's role is, and give a little bit of that background. So I'm going to walk through a couple of really high-level slides first, just to kind of give an overview of Metro's housing department. This is not news to any of you because you're doing the work every single day, but in 2018, recognizing that there was a need for affordable housing in our region, Metro Council moved forward and voters passed the Affordable Housing Bond, which is going to bring 5,288 new affordable housing units online. I think the important thing to note about this is that before the housing bond, Metro did not really have a footprint in housing. We were all about transportation, solid waste, the zoo, the convention center and visitor venues, the Portland 5 Center for the Arts. This was really the first time that Metro came forward to say, okay, and as we think through the regional challenges that we have, housing is one of our major regional needs. And that was quickly followed up in 2020 by the Supportive Housing Services measure. And so that is obviously something you all know intimately because so many of you were doing work on the ground that is really implementing that Supportive Housing Services measure. We can't thank you enough for that because frankly, our providers are the most important part of that continuum. When we say 5,000 chronically homeless households will be housed and 10,000 households will have stable housing, like that isn't just a number. That's work that's already happened. We've actually hit these goals pretty much. And that is work that is the result of you all. So I just, again, really want to emphasize and appreciate and support, like, that is one-on-one relationship building. That is one-on-one case management. That is working diligently with your clients and not taking no for an answer. So major kudos. Thank you for the work that you're doing. And what we're here to do is to work to try and help you continue to elevate so that you have the tools that you need to do it the best way you can. I think it's important also to just kind of remind folks where Metro and the counties all sit within this this SHS system that we have. So Metro, our regional government, which has a footprint in all 3 counties but doesn't cover all 3 counties, with SHS is really has the 3 key roles of collecting and distributing the tax funds to the counties, conducting oversight and accountability on the program implementation, and develop and implement policies and programs that work toward advancing a regional system. When it comes to the counties, they have the incredibly important job of developing and issuing contracts with the SHS service providers that are in our region. They design and implement the programming that you all then are working to move forward. And they collaborate with Metro to implement that regionally aligned system, Training, one of those areas. I'm going to go into the other areas that we're working on toward regionally aligning the system. Service providers, you all, like I said, have the most important role in this entire continuum. You are the ones who are actually on the ground doing the work and ending people's homelessness. That is everything that we need in this region. And again, thank you for the work that you're doing. And then, of course, it's all about our participants accessing services and you all having the funding to be able to give them the support that they need when they need it. I want to touch on really quickly what a regionally aligned system looks like as far as the work that Metro and the counties are doing together. One, we're working toward a coordinated entry system that is more coordinated across the region. We just heard about the healthcare and homeless systems alignment. That's huge. It's amazing, Alyssa. I'm kind of blown away to see that there are like 10 or 15 agencies that are implementing the Medicaid 1115 waiver. That's awesome. And that's work that Metro has been supporting with as well, along with the counties. Unit and landlord recruitment, ensuring that we have places where we can place people who are getting from the streets. Employee recruitment and retention, ensuring that you all have the support and tools that you need to be able to do your best work through pay scales and others. And then technical assistance and direct service training, which is the work that our team is doing and that we're excited to tell you a little bit more about, especially on that direct service training. As I mentioned at the start, Justin, Malia, and I are all part of Metro's regional capacity team. That formed in 2024 with the idea that we could increase the ability of the system to provide consistent, sustainable, and quality services across the Tri-County region, especially focusing on the needs of service providers. So we are the first team at Metro that's really developing service provider-oriented work and programming. And our current priorities are first and foremost a technical assistance project for permanent supportive housing service providers that's in process right now. And we've got some great providers working on it, including URCO representing Washington County, and identifying accessible trainings for frontline workers. And that's where we're really going to get into in just a few minutes. The last thing I want to share before we turn it over to Justin to talk through the training program that we've been developing is about racial equity. Racial equity is at the corner of every single process, project, and policy that Metro implements. We recognize and voters recognize when putting the supportive housing services measure together and to the ballot that racial equity is so important because communities of color experience homelessness at rates far disproportionate to their white counterparts. And so to embed racial equity in this training program, we have worked collectively and collaboratively with our county partners to conduct a cross-jurisdictional racial equity analysis that's informed the programming. We are every single week working to move those recommendations forward. And as we move through future potential implementation around training, we're also committing to do a racial equity analysis at the start. And with that, I'm going to turn it over to Justin to talk through where we're at with the Housing Service Worker Program.
Thank you, Cole. And so we have a few different training resources and programs we'll be presenting to you today, but I'll focus on the PCC program myself and then hand it over to Malia afterwards to go through the rest. Next slide, please. So Metro and PCC's Professional Development and Training Department are creating a housing training program to help meet the needs of currently existing training gaps for frontline service providers. This course is no credit course. There's no prerequisites to engage. So there are none of those barriers that traditionally accompany a higher education institution. You don't even need a GED to get into this course. So it really is low barrier. The courses that we are developing are on the screen, and I'll list some learning outcomes. And these are just the first two initial courses that we are developing through PCC. Excuse me. So the first is Fundamentals of Housing Case Management, which includes modules on understanding systemic racism and homelessness in the metro area, a housing system overview, resource navigation and barrier reduction, and fundamentals of housing case management. The second course is Basics of Housing System Navigation, which includes modules on understanding systemic racism and housing in the metro area, housing system deep dive, housing navigation, and housing retention and eviction navigation. If you noticed, there is a racial equity aspect built into each course. And as Cole highlighted on the last slide, this reflects our commitment to leading with racial equity and helping to ensure that everyone who takes our courses is aware of the barriers that their clients have historically faced and continue to face, as we understand and believe that that knowledge is fundamental to accurately and efficiently helping someone move through the system. Will be available for these courses? And so the first cohort of this course will be comprised of members and employees who work at SHS contracted organizations and who have been in the field for 0 to 6 months. We're trying to make that first cohort centered around individuals who are just entering their career to really help them get that training they need up front as they get into the work. Next slide, please. So I just told you the what we are developing, and now this timeline will help us go through how we got here and where we're going next. And so, as Cole mentioned, in 2023, TCPB, which is the Tri-County Planning Body, for those who are unfamiliar, is our oversight body for the SHS funds, identified 6 various goals to help regionalize a system of homelessness care. Training, which was one of those goals and is the topic of today's presentation. In 2024, after getting the training directive, we wanted to better understand the landscape of this work. So that this program already exists somewhere else in the country or locally. And so we did a landscape analysis, reaching out to organizations, so training organizations, nonprofits, institutions of higher education throughout the country and locally to understand if this program already existed somewhere. We found that it did not, and after all these conversations, the one we are developing is pretty unique, and with particularly its regional lens that is we didn't see anywhere else in the country. And so we were able to move forward after a bunch of research that is collated into a research paper that kind of serves the basis for all of our work that we're doing here. So we were able to move forward with program creation, knowing that this was not already existing somewhere else. And then that same year in 2024, we wanted to develop a collaborative curriculum to meet the specific needs of providers in this region. So to do that, we surveyed jurisdictional partners at each of the counties. Thank you to everyone on the call who took that initial survey last year, asking what training programs or skills they would want on day one when they first started in their positions. And then we surveyed, after getting those results, we surveyed the counties. Surveyed providers to make sure the curriculum that the counties identified meets the needs of providers. And then we gave that curriculum outline to our curriculum developer at PCC, which happened this year in 2025. We signed an IGA earlier this year, and we're well underway with curriculum development. And again, that development in that curriculum is based around this collaborative outline that was created, because any program that we do produce, we want it to be specific to the region's providers. That is a lens that we're very clear on we want to have, and that's what we're working towards, and that's why we're here today. So thank you all for being here for this, allowing us to be here. The green dot is where we are now. So of course, 2025. We're currently doing outreach to help inform program development, and I'll get into this on the next slide, but we're standing up a work group to help with that process as well. And then early next year, we'll be developing some frameworks for how to fill the course. We can offer these courses at PCC on basically an as-needed basis. And so we'll be trying to do some outreach for that, and that's part of today's mission as well, to better understand how we can sustainably fill this program that's not burdensome on Metro or the providers, but also meets the need. And fingers crossed, we're hoping that we have our first cohorts late spring, early summer next year. That is our goal that we're on track for, and we will start doing outreach closer to that to fill that course. Next slide, please. Okay, so on the last slide, and at the beginning, I alluded to some engagement opportunities. And so my colleague Malia will be dropping some links in the chat that I'll be going over now. So you'll be seeing links for 3 surveys. One is for frontline service workers, and one is for organizational leadership. That ask questions about relating to the PCC program and some other training initiatives that we would love some feedback on. Please feel free to take these surveys yourself, whichever one is applicable to you. And we'll be sending a follow-up email after this call, more than likely tomorrow or later today, that will have a draft email for you all to send out these surveys to your staff as well. Please, we're trying to get as much feedback on this program as possible because we be using the feedback. And so any piece of feedback you can give us, we will appreciate. And then for the work group, which is a more robust engagement opportunity, we are standing up we're calling it the PCC Curriculum Development Work Group. Really, this work group is designed to ensure that what is produced, again, meets the specific needs of our region's providers. We did develop that collaborative curriculum, but we're really trying to make this a reality, this tailored curriculum. So this work group will be comprised of 9 members, 3 from each county. It will meet once a month from November to April, so 6 meetings. And work group members will be asked to consult on the content of the curriculum, so making sure it meets their needs and is relevant to their work. They'll be asked to advise on any equity considerations, so anything that we might have missed when developing this curriculum. And we're trying to get the curriculum full of real-life examples from providers in the region. So we want everyone to be able to see themselves in this course and have some applicable examples that you might experience in the Portland metro area. We also recognize that, this is a lot of work, this work group. We're asking every participant who is selected to show up to each meeting, having reviewed each module, and being ready to have a discussion. And so recognizing that and recognizing the burden this can place on already, overburdened providers and you all, we are offering a compensation of $200 per meeting. So if someone attends all 6 meetings, it's $1,200 to help with that burden and to really just, lead by example. Like instead of asking for free work from overburdened providers, we want to give you I think some kind of not just incentive, but some money that's owed, like this is going to be work. We don't want to ask you to do it for free. So please, if you know anyone on your teams that you think would be a great fit for this, thank you. Please spread this around. It's a lot of work, but it's going to be a good time, I promise. We are doing stuff here, and I'm excited to bring the opportunity to you all. And now I'll pass it over to Malia to go over some other opportunities.
Thanks, Justin. Okay, cool. So upcoming opportunity, the PCC Housing Training Program. But in the meantime, we have a couple of immediate training opportunities you can take part in. If you'll go to the next slide, please. So the first I'll talk about is on-demand training. We did a pilot. Some of you might have participated in it, or people from your agencies. If you'll go to the next slide. We use 2 different organizations with online on-demand training programs. So one of them is the National Alliance to End Homelessness. This is what their training platform looks like. It's called the Center for Learning. And then we also use the Corporation for Supportive Housing. They also have an online training platform. And so we launched a pilot. There were about 30 people who participated, and they took training 7, I think, each trainings during the pilot. And they took surveys after they took each training to be like, was this useful? What did we like about it? What did we not like about it? And if you'll go to the next slide, these are some of the results from those surveys. So on the left, you'll see 2 questions that I thought were pertinent. Did the training content effectively prepare you for the responsibilities of a frontline housing service worker? And then how confident do you feel in applying the skills learned from this course in a real world housing service worker role? And you can see it's generally positive. That first column is the answers for the Corporation for Supportive Housing. And then the second column is the NAEH, National Alliance to End Homelessness trainings. And you can see that the NAEH trainings trended slightly higher. But in general, it looks like people felt like the trainings were applicable for frontline housing service worker roles, and they felt confident in applying the skills. If you'll go to the next slide, these are some quotes that we came away with in support of the online training. So I kind of like this one of some things just need to be learned through experience, but these virtual trainings lay out a lot of really valuable foundational information, and I learned more than I expected to. In addition to these like positive, supportive quotes, we had some, I think, of the negative feedback for the online training platforms mostly was for CSH trainings, and it was there were some that were like pre-recorded webinars that were just posted as trainings, and people felt like that format didn't really work for them. You know, it wasn't very like engaging. But the trainings that were not just pre-recorded webinars and were more interactive, people liked better. So we want to continue offering this opportunity to people because it seems like it was helpful, and we're going to expand our offerings for on-demand training. We're going to stick with just one provider this time because that was another piece of feedback we got, that people had to sign up both through CSH and NAEH, and it was really confusing. So we're just going to stick with NAEH this time. And before there were some deadlines, like you need to complete the training by this time and complete the surveys. And at this point, we're just going to have people enroll themselves and complete the training by yourself. Once you enroll in a training, you have 60 days to complete it. During the pilot, we had a limit for staff per organization who could participate. So 3 staff per organization that were in the pilot program could participate. We won't have a participant limit per organization this time. And the timeline is today or October 2025 through June 2026, depending on how long funding lasts. So we'll have to see what the demand is, how many people are interested in taking these. We'll send out access information through channels that you're already, you know, it sounds like HSSN sent out our training information. I did see that come through. That was great. So we'll send out that information on how to access this program. But if you want to make sure that like your work email is on that outreach list, feel free to just email our team email. I'll drop it in the chat for you, and we'll put you on the outreach list specifically. And I think that's it for on-demand training. Our next resource is not as exciting, but it does exist, and it is a training resource webpage. So when we were, doing initial outreach, trying to figure out from providers what was important for them in the training space, like what were they missing, and we heard some folks say like, I just need a list of trainings for housing service workers. Like if I'm trying to find training for my staff, every time I'm trying to secure training, I have to go Google stuff, or I have to like reach out to my networks to figure out who's using who for first aid training, who's using who for trauma-informed care training, And so through some outreach and crowdsourcing, we created just a list of training resources in the region. If you go to the next page, this is what it looks like. And I'll drop the link for you in the chat. And there are a variety of trainings on here. If you'll go to the next slide. So some are free, some are fee for service, so you pay for them. Some are in person, some can be virtual. There's trainings in English and in Spanish. And they're all related to housing case management, housing services. But there's just a lot of variance in the topic. So you'll like the first one that's listed is American Red Cross for CPR first aid. We have people who are doing like more housing specific training. So just letting you know that that exists and that's there. There's also an opportunity if you know a training resource that's not on there, you can submit a feedback form and be like, hey, this is a really valuable training resource I use and I'd love to see it on this list. And that's it for me. So I'll pass it back to Justin.
Thank you, Malia, and thank you all. We want to open the floor to any questions y'all might have about any of the training implementations we have underway, or really anything else that is training related for Metro.
If I can't find my like raise hand feature, can I just ask a question?
Go for it. Yeah. Thanks, Cameron.
Hey, so the trainings that are listed on the Metro site, the trainings that have been now extended to more people that are interested through the NAEH kind of training site, will there be like duplication or like bringing that into this training program for frontline workers through the PCC kind of like training that you've been describing that's going to get launched, right? So is it kind of like bringing forward those trainings into this next level, like certification trainings type stuff? Do you see where I'm going? Like where the
How are the
question?
NAH programs related to the PCC program? Is that the question?
Yeah, right. Like, is it bringing forward that stuff? So, like, if we had people that were like, "Oh, I'll take advantage of that NAEH stuff," is it going to end up feeling kind of duplicative if they also do this frontline worker certification later when that gets launched?
Good question, Cameron. Yeah, so the PCC, we recognize that the PCC program will take some time to develop. It is kind of a multi-year process of an IGA and development and outreach and refinement. And there is a training gap that exists right now. And so really the idea behind the on-demand training program was to put these immediately available trainings available by the National Alliance on Homelessness. And at the first time of the first iteration, the Corporation for Supportive Housing, to help meet that need and see if they are helpful. Down the road, we have discussed what it would look like to put the PCC course and learning modules online somewhere on the Metro website that really directly ties the PCC program and makes it more accessible. But with the on-demand program, we were looking for accessibility really and immediate opportunity. And so the overlap between the course offerings, it doesn't exactly line up. I'm sure there will be some congruence, but they're not exactly related in that way.
Awesome, great. I wanted to be able to like promote that
Thank you.
demand and immediately available resources to our frontline workers sooner rather than later. Because yes, developing a whole training certification program is a process.
Taking a while.
Yeah, for sure. And like kudos for all of the work that your team has been doing to like get this going. It's so appreciated. And also for like, answering the call that like we need things now. What can it be? And thanks for extending that to more people.
Absolutely. Yeah. Thank you, Cameron.
And I just want to thank all the providers, some of whom are on this call that were in the initial training, the pilot for seeing if those NAEH trainings were even useful, because that's really what's kind of launched us to the point of being like, okay, yeah, providers are finding these useful. Let's get this word out. So kudos to so many of you who helped us analyze that.
What other question do folks have?
Well, it looks like you guys must have covered everything. Thanks, Metro team. Thanks for all you guys are doing.
Thank you
Thanks for
all.
making some time to just update us and resource us. Very much appreciated.
Thank you, Adam.
Okay.
I'll be sending a follow-up email to you and everyone with these resources in the email body. So I appreciate the time. Yeah, thank you.
Cool. Yeah, thanks, Justin. Okay, well, we're gonna move forward on our agenda. It looks like at this point there's not a public comment for us to process in this meeting.
Hey, Adam, actually we did have one public comment requested.
Okay.
So I think if that person wants to submit or come on camera or unmute, they can share their comment.
Yeah, I just responded. And so thanks, Martin, for saying that I did have a public comment. Is that okay? now, since I did request this time. Okay.
You're good to go.
Thanks. I'm just pulling up my little thing here. And also appreciate those who are still in this meeting, since it's after some of the announcements and presentations. Anyone who knows me, some of y'all do, know that I'm a fierce advocate who's always thinking, acting, and doing with the end user in mind. The person still unsheltered, the person waiting for that housing program referral, the person finally being contacted for a housing program opening. And yet, just a couple weeks ago, I had to work through a very overstimulated, overwhelmed referral to the program I manage because this person was told there's a 2-year program and a 10-year program, and I can go from the 2-year to the 10-year. And in January of this year, I switched from working in the HCMS SHS program to the ERRH SHS program. And at that time, I had a single mother who was told she could go from the 2-year to the 10-year. And it's been really hard working with her to pivot to what could happen when her 2 years end in March of this upcoming year. So I want to point out that I am saying 2-year and 10-year program because that's how workers in this field are still referring to these medium and long-term SHS interventions. Clearly, people are still telling me that they're hearing this only weeks ago. And I'm asking that we stop this immediately. But shout out to the OGs who have been here before SHS and those who were here when it was a 2-year and a 10-year program. But it stopped being a 10-year program as soon as it started. The clock has been ticking, and lately there hasn't been openings for people to transfer from medium-term interventions to long-term interventions either. We still have people being misled with misinformation, and I'm just one person trying to right this wrong in 2025, 5 years later. Are staff and assessors still using these terms of 2 years and 10 years? Has the information not been shared out that we have not secured funding beyond 2030? That there is a limited likelihood of going from medium-term programs to long-term programs seamlessly? Have we not been making every effort to inform those still waiting for a referral to come through and dispel the misinformation that is still happening? Are shelter-based housing liaisons also not trying to work with shelter guests to find employment and housing in case that referral never comes through? Gone are the days that direct service staff had the information they needed directly and when it was needed, the office hours, the newsletters, and now it's giving our leadership information who give it to us, who then take our inevitable questions because we're the ones on the ground having to do this work and have questions, taking it back up the chain of leadership to maybe getting answers weeks to months later. So if you are here, please be very mindful about not using 2-year and 10 years to describe these programs that we have currently, and telling folks that they can seamlessly go from a 2-year program to a 10-year program. It doesn't exist. And if you are responsible for training and informing your staff, please check in with them about how they are referring to these programs, because words do matter. Hope is very much alive as it should be, but we need to be realistic. And if we do stand a chance to extend these programs past 2030, it does take being honest and upfront with our community about the reality of our currently available programs. Thank you.
Thanks, Cameron. Thank you for the comment and the reminder and the direction. Okay, we're going to go on to our general business with an update in veterans and housing from Gary. Gary, if you're ready, go ahead and unmute and turn on your camera.
Good morning. Hopefully everybody can hear me. I think Lindsay maybe had some slides that I passed along. And there would be kind of some of our stuff that I work with. So I work for the VA Medical Center, which is now called the VA Portland Healthcare System. It's a part of the VA programs, the hospital center actually that does a lot of housing programs. When I started back in 2009, we had literally, I think maybe 50 VASH vouchers that we started with. and probably another 20 project-based vouchers that were kind of spread out through Portland and different locations. And we have grown tremendously over the last 16 years, and it's been fun to watch. It's been good to see for our homeless veterans and their families. It's been an amazing journey. So for the last 9 years, I've been here at the Salvation Army program, which has transitional housing program here in Beaverton. And this houses 48 veterans in one grant program. And we have another 10 beds that will house another 10 to 15 at times, depending on the funding that we get. Sometimes we get a little additional funding like this last year, since we've been very full. I did this presentation kind of last year also, and at that point we had just finished the renovations on the building here in Beaverton and put a lot of money into it. I think the grants were over $5 million. Some of it was federal grants, others were grants that Salvation Army had procured. And just amazing to see the changes in the building. Now all the rooms are single rooms where veterans don't have to share space anymore, which is a huge thing for them. And we actually have about 20 kids in the building right now at this moment. So we house families here, veterans with their spouses or single veterans with children, veterans with spouses and children, veterans with dogs, cats. A lot of options for veterans at this facility. Of course, you know, there's some things that are a little challenging in this building. If we can go to the next slide. Yeah, so the program information, I'm not going to go over all this, but that's where some of the challenges come. We do curfew. We do have breathalyzers twice a day. We do random UAs. So it is a program. I always promote that. But over the years, I think we've become, I don't want to say lenient, but we've done a great job on trying to work with the veteran where they're at and trying to help them through recovery and trying to help them on their journey of getting housing. So seen a lot of changes over the years and a lot of good progression. Next slide. Yeah, so a lot of things that we look at, we'll look at income, we'll look at trying to improve their income. We actually have a VSO on site. We try to help with medical and mental health help, recovery-based programming. We actually have about 4 different groups here on site, so a lot of good supports. And then, you know, veterans that are in wheelchairs, we only have 3 ADA units in the whole building, so it's a little tricky for ADA. We have 3 different levels to the building, so the ground levels where the ADA units are at. So it's a blessing to have those 3, but the building in itself on the other levels can be a little tricky if you're in a walker or wheelchair. So it's not always ideal, but as long as the elevator is working, we're in good shape. Some talk of us replacing the elevator here hopefully soon. Next slide, please. And that's our location. It's right by Marysville Valley Catholic High School, grade school, high school. It's right there close to Farmington and Murray. So next slide. And there's an overview. We're kind of in an interesting on Farmington, so it's a busy street right there, but the bus is right there, so it's great, convenient. Next slide. Yeah, so the hallways, new flooring, new paint, new everything. It's looking good even after a year of kind of going through lots of stuff, lots of touch up. The maintenance crew is always busy. Next slide. That's the lobby area. So we got computers in there. They try to do a little tech class once a week and try to help out with job searching. Next slide. And that's one of the rooms. So not all the rooms are this big. This one might be able to house a veteran and spouse, possibly a veteran and a spouse, and maybe with a younger child. So we only have 3 large family rooms in the whole building. So if you have multiple children, we're definitely needing a bigger space, which we only have about 3 units. there are a couple other side units, so that maybe about 5 units that could house, families with 4, maybe 3 or 4 kids. Next slide. And that's our dining hall area. So we do 2 hot meals, and they've actually updated all the tables and got rid of the carpet. So now there's wood laminate flooring down there. So that makes it easier to clean. Next slide. In our garden area out there, so we have a garden space, which this year's garden, I think it's been the most amazing garden I've seen in my 9 years of being at this program. So it's Salvation Army does a great job with the chaplain doing a lot of support and finding community support around garden. They even have a little greenhouse, so a lot of good tomatoes this year, zucchinis, green beans, stuff they've used in the meals. With the meals, they do lunch and dinner that are the hot meals. The breakfast is more a la carte, but they've been able to use the lettuce, the herbs, the tomatoes, all that, which has been great. Next slide. And that's the side of the kind of the side of the building. It shows kind of where the ADA door is on the ground floor there. Next slide. Yeah, you can't see this one very well. I think I actually have a handout of this one. This one talks about our outreach social workers that do an amazing job. They actually have a good setup. So I don't know if you can pull up the flyer. There was a flyer for our one was for the stand down and the other one was for the walk-in hours. So I'd like to promote the walk-in hours that we do at the Hillsborough Clinic. Yeah, there it is. So the VA does a lot of different things around homelessness. There's programs in Portland, there's programs in Longview, there's programs in Salem, there's programs in Vancouver. So we have programs all over, which is great. We used to have one in Bend, but that one closed about 5 years ago. So we got a lot of options for individuals that maybe want to work on different kind of goals. Salvation Army is definitely not going to be for everybody because of breathalyzers and lots of UAs and room inspections and things like that. So a lot of the other programs are a different feel, especially the downtown Portland ones. So the walk-in clinics there. We have a clinic right there in Stuckey. And I think it's twice a. I got to zoom in my own eyes here. Sorry about that. The Hillsborough Clinic right there in Stuckey. So it's right by the Tannisbourne outside mall there. And yeah, it's second and fourth Thursday from 10 to 1. And Jennifer Tinsley's our outreach social worker here in Washington County. So she does an amazing job and will help veterans with any options around housing. They can help put a veteran on a VASH list. So the VASH vouchers are those vouchers that I kind of talked about initially, where we've had these vouchers since before 2009 when I started. So about 2008. Now we're up to 2,400 vouchers in the metro area with all of our different sites. Washington County, we have about 322 vouchers. So these vouchers are like Section 8 vouchers. They subsidize your rent in an apartment. And it comes with a VA social worker that actually meets with you once a month to work on goals, help with resources and supports. And that voucher, of course, goes for a lifetime if your income doesn't go over. They're using 80% AMI, so it's about $70,000, almost $70,000 now that you'd still be eligible. But of course, that you're paying a third of your income, so it gets a little quirky. Right now, I'd say in Washington County, every county right now, we have a good list of veterans on the list for vouchers. So vouchers are a little difficult to come by. The beautiful thing that we can always promote is with those walk-in clinics and going to different places to get supports is SSVF, which is Supportive Services for Veterans and Families grant. And Community Action does it here in Washington County. Transition Projects does it kind of metro-wide. And then Easter Seals also does it in Multnomah County. So, and some of the other counties have different people doing it. But it's a temporary subsidy to help veterans get into housing and help make the rent affordable for a short period of time. Whereas, of course, a voucher, everybody would love a voucher. We just don't have enough for every veteran. Sure, everybody out there kind of knows the plight of vouchers and not having enough. I do have one more slide, which I want to promote the Stand Down coming up on November 7th at Sunrise Church. And that is an amazing kind of outreach event for veterans, for resources, mostly homeless veterans, but low-income veterans could go. I always see a lot of alumni that I've seen over the years doing this work that go to stand downs, and they go for support. There's a meal, sometimes there's haircuts, there's a lot of different things going on. So it's always an amazing event, kind of like our Project Homeless Connects. It's similar to that, where there's just a lot of resources on site. So if anybody has any questions, I'm always open to answering questions. I specifically work through the VA, but I'm here at the Salvation Army program 5 days a week. So I'm not as knowledgeable about all the resources out there. And that's where a lot of those walk-in clinics on that one flyer could be helpful for people for other resources out there. But I can always direct people to where resources are at for veterans. So I really appreciate you guys giving me some time.
Great, thanks, Gary. Appreciate the information. And yeah, we did have a question about possibly getting links to those handbooks, and it looks like Martin is going to work out a solution for that and possibly putting it in the digest coming up. So be looking out for that.
Awesome.
Yeah, thanks for the update. Okay, and then we're going to hear from Kim. I think I saw Kim on the call for the Solutions Council. Kim, if you're ready, jump on.
Hey guys, happy Wednesday. Gary, thanks for that shout out. Appreciate it. Solutions Council. So lots of big discussions happening. All of our Solutions Councils are public forums. So you are more than welcome to jump on either virtually or come in person. There is an opportunity for public comment at the beginning of every Solutions Council. We are having a lot of discussions about the LIP right now, the Local Implementation Plan. Our next meeting, which is November 20th, will be focusing on that. No, it's not. Our next meeting is in October. Talking more about the Local Implementation Plan, but what I wanted to say is that on November 20th, we are going to be having a Local Implementation Plan listening session in the work session room of the Board of County Commissioners. And so more information about that will be going out, but that'll be a great opportunity to hear more and also give a lot of your feedback. I know there's other ways to give feedback. Martin, is that you putting in the chat? Via some form that I don't know exactly how we get to, but I'm sure someone's going to throw it in the chat and make sure we have that link for everybody to be able to give their feedback for what you want in the Local Implementation Plan, particularly at this cusp. We're at the 5-year mark of this funding, so we have an opportunity to really look at what's working, what's not working so well, what changes we want to make, and how we want to move forward for hopefully more than the next 5 years. Hopefully we can extend this bad boy. So that's what we're doing at Solutions Council. Again, you're always welcome to join us. The information is on the county website at all times. Again, wonderful staff at SHS posting stuff into the chat. So please make those public comments. Okay, have a great day, you guys.
Thanks, Kim. Okay, just a few final announcements, and we'll actually end a few minutes early. A reminder, if you or your agency would be interested in offering a presentation during this HSSN meeting, please reach out to Lindsay. She'll drop her email here in the chat, and you can reach out to her. And also, it is the start of a new month, October 1 today, and October is Domestic Violence Awareness Month. And I know that this is something that affects many of our clients and friends and people we work with. And so I've put a few resources in the chat that can assist with local help. And our next meeting will be November 5th, Wednesday, November 5th at 8:30 a.m. And to close our time, we'll open up the floor. If you've got an event or kudos or highlights from your agency that you want to share, now is the time to do so.
Good morning. I would like to introduce myself. My name is Michelle Marcus. I am with the Peer Company, formerly MHAAO, and we are starting our second year with our Growing Oregon Peer Leaders cohort. That is for peers with mental health, and usually in rural areas, who are leaders or wanting to grow in those skills. And we have the application process open for about 2 more weeks. I can put the link in the chat. I did earlier, but I'll put it in again.
Cool. Thank you for that, Michelle. Appreciate it.
Thank you.
Okay. Well, everyone, thanks for making time to be here today. Hope you have a great rest of your week and start to a new month. Take care.